Welcome to Real Recovery Unplugged, the podcast where healing meets hustle, faith fuels purpose, and real stories spark transformation. I'm your host, Dr. Haley Brown, founder and CEO of Real Recovery. I'm an osteopractor, entrepreneur, believer, and someone who's passionate about rewriting the script on healthcare one life at a time. Each week, we'll pull back the curtain and have raw, unfiltered conversations with our staff, doctors, fellow healthcare providers, athletes, patients, and inspiring voices from all walks of life. We'll also get a behind-the-scenes look at what it really means to build a movement, not just a business. So whether you're a provider, a patient, or someone chasing a purpose bigger than yourself, you're in the right place. Let's get into it. All right, you guys, welcome back to another episode of Real Recovery Unplugged. I'm Dr. Haley, the host, and over here to my left is Abigail Crowe. She is the founder of Alchemical Training, and she is just overall a certified badass.
Oh, thank you. Thank you. What a great introduction.
Welcome.
What a kind introduction.
So, Abigail and I have known each other for 3 years now? 4?
It feels
3?
I feel like I've known you for so much longer.
A lifetime?
Yeah, an eternity.
Soul sisters.
Yes.
So anyways, we've collabed on so many different athletes.
Yeah.
So many different athletes and regular day average Joes too. I think one of the biggest things is lately, with culture shift and everything, running is becoming super popular again.
Which is crazy because I really would have guessed that would have been more of a during COVID situation, but it's after.
It is after. And even with the Tallahassee Marathon last year, it was a record number of runners, but a record number of runners in the college age group.
Yep.
Which is really exciting. And then of course it's always endurance athletics have always been a little bit more popular in the slightly older, more established adult, because I guess, they're
because you're out of sports. You're not in a college sports setting anymore, even though there are collegiate endurance athletes, but it's just more of a in quote hobby that you can get into that you turn into a later sport.
Right. So I think one of the popular things that a lot of people ask is running bad for you?
The way runners run is bad.
It's a loaded question. The answer is yes and no.
The answer is everything's bad for you in certain quantities. And oftentimes runners, the way in which they prefer to run and the way that they set up their schedule, it sets them up for failure or pain, really, is what I would deem as failure.
Yeah.
But no, running's not bad for you. I think that anything, lifting is great for you. Lifting can be horrible for you. There are plenty of coaches, we tread the line all the time in terms of just how we lift and how we train and in not safe, overdoing it ways. And so anything done the wrong way can be bad for you. But no, running is not bad for you at all.
Right. And so I think the biggest thing too is, okay, well, I have previous XYZ injuries, or I hurt myself while running, and now every time I try to run again, I start having pain. And so I think what's cool about today, our plan is to kind of give you guys the behind the scenes information that a lot of people aren't privy to until they experience this for themselves, of how do we work with this patient, right? Or this athlete? How do we kind of look at their running mechanics, look at their overall strength in different areas, look at their nutrition as well and those things, look at how they're sleeping, recovering, and how do we actually properly program something to where they can be running and enjoying it, or then running and competing if that's what they wish to do. So I think what would be cool is if we kind of just take this as we had an athlete that presented to us. Let's go with a 35-year-old mother of 2, works a 9-to-5 job, and she runs to keep her sanity.
Word. Yeah. Truth. I think that's why so many people come to me. We joke, but that's real. I think that's why so many people come to me. They come to me, one, as a last-ditch effort, which is just it makes me so sad. I'm like, why do I have to be the last-ditch effort? The strength coach.
First priority.
I wish.
Things, yeah.
But there's so much misinformation around strength training for running, so
right.
I don't blame them. But anyways, they come to me as a last-ditch effort, and it's because running truly is not just a thing that helps with their health. I get out and positive endorphins, and I, work on, my heart rate, and I sleep better, and it's literally just I do this because it makes me feel at peace, or it gives me a sense of community, or I feel empowered when I do it. And so people come to me and they're not just I need you to help me so I can run again. It's I need you to in some ways give me my life back again.
Yeah.
That's what I'll feel
Yeah.
when they come into the training room.
For sure. And then same thing, I'll catch people on the back burner of that is the one thing they do for themselves out of their entire day.
Oh, yeah.
And they are habitual about running, and it's phenomenal. But then because that's their one escape, anytime they have ache or pain, they start running through it. They continue to train through it and everything. And then it's to the point where they're like, okay, I can barely walk now. And now I've lost my means of, it's like their own mental health therapy too and things like that. And so they're coming in, they're like, get me back to running now. And I'm like, okay, well, let's really break this down,
Yeah.
right? Like ultimately what brought us here, right? Is it just simply too much load? Is it faulty mechanics? Like what is it? And that's my job, right? Is to try to pinpoint those things. And is it a tendonitis, or is it something that's going on with your alignment in your hips is causing you to load more of your anterior knee and all that? And
Do we have some kind of overuse injury that's treatable, or are we dealing with a tear that you've been avoiding? Is this pain as a result of a stress fracture that's now, creating pain elsewhere? Like, how long has this pain been going on? How long have you been avoiding it? How long have you been trying to work through it? Those are all things that you and I both are looking at. Yep. And often whenever somebody comes into me, let's say that this runner doesn't have necessarily anything like really, really bad going on. They just have some like overuse acute injuries. Or maybe they have like a chronic pain, but it's because of overuse, and it's just bothering them all. It's like this dull ache all the time. Usually I'm looking at volume first, almost always. It's actually not even necessarily, they'll be like, well, I just don't do my speed work because when I run really hard, it hurts more. But it's often because their miles are just over the week are way too high in general. And they've accumulated way too high of mileage. And then on top of that high mileage have been running with poor mechanics. So it's like double whammy of like, you're running with poor mechanics. You don't have you don't have the prerequisite stability or strength or power to get you through all of your week of sessions. Sometimes it's even in your actual one run. So now under fatigue, you're running, which is going to make your running mechanics worse. And then you're going to experience pain. Yep. And so often it's like, we need to back off volume. If you really need to run, do your quality runs, even if they don't feel quality or you're not hitting the times you want. Keep your quality runs in. Those like extra easy miles, like they're gone. You're done with them for now.
Yep.
And then I'm looking at what am I seeing in terms of where's the pain presenting, and what am I looking at in my eval of how they're moving, to then start prescribing some exercise and some drills to get them to a place where they're running a little bit more efficiently. But most of the time, when they come to me, I'm wanting to immediately refer them to you, because when they're already in pain and they're in some sort of flare up, or they're really emotionally turbulent as well, it means we need to, which by the way, the psychological component of pain, it exacerbates pain
1000%.
immensely.
Yeah.
So if I can get them into your room and I can get them treated and I can get that area to calm down, now we can do real work. Because until then, everything that they do, often I'm trying to hammer that area. It's just going to they're going to feel flared up. They're going to feel agitated. And it's not because we're doing the wrong thing. It's because we're doing the right thing at the wrong time.
Exactly. And that's the biggest thing too, is, a lot of traditional physical therapy treats these types of patients wrong because they're like, okay, well, here's some exercises to address that. Yes, exercises 1000% have a time and place. But if you have someone who's truly inflamed and is in this acute flare up period, you can't just give them stretches and like think this magically going to get better. Like that's like with the fellowship program that I did in manual therapy. And like, I'm the only person within 250 miles of Tallahassee that treats this way. But like, if you help the body create a better pH in the environment of that muscle region, of that tendon region, and you bring increased blood flow to that through a variety of different ways, but by actually creating tissue change, it downregulates that whole nervous system, and now gets your body to a place where it's ready to accept a healing process, and it's not just paused in it. And then from there, like what's been phenomenal with you and your expertise is, because not every trainer can do this either, you know how to properly deload in an area that we need to while loading extra in the areas of weakness that ultimately led to this repetitive overuse injury, XYZ, whatever it is, in this region. So it's phenomenal because then I get to focus on my part of doing my job, or my other doctors doing my practice of, let me work on this patient and create tissue change in this area. Let me do manipulation on them. Let me do dry needling or cupping or soft tissue work and all those things. And then I know they're going to be able to go to Abigail and continue working towards their ultimate goal and continue loading, where Abigail is not going to do the things that are going to bring them right back to this acute inflammatory process.
Yeah, absolutely. I think too, strength training, there are not a lot of coaches out there that understand exactly what goes into a runner's week. And also they don't necessarily take into account a runner's history, which is a lot of people who they might have had previous sports backgrounds, but there are a lot of people that just genuinely, like, they just ran their whole life. And that was like their exercise, and they've literally never strength trained. And so strength training for runners sometimes looks like how people would look in a PT room doing rehab. Like, it's not some exciting, we're going to freaking be on this machine and go to failure, and I'm going to have them. Like, there are times for sure where I'm loading them up. But most of the time when people come to me and they're in pain and they have a problem, it's a lot of isometrics. It's a lot of, like, very much unilateral variations. It's a lot of core stuff. It's a lot of rotational work. It's a lot of anti-rotation work. It's a lot of, I mean, it's quite boring, to be honest, for the most people.
Yeah, like relearning how...
It's learning how to move again.
Here's your left side, here's your right side, here's how you stabilize both individually, and now tying them back together. Because that's all running is.
It's me. I'm like, I always joke. I'm like, I think you guys are like making me look like I've acquired a foot fetish, because it's like, it's a lot of just looking at their feet. I'm looking at their gait.
All the barefoot training.
Yeah. Oh my God.
She charges extra.
Legit, people come in and they're just like, shoes off. And I'm like, shoes off, because it's like, I have to get them to a place where I'm looking at their feet and I can see what they're doing and where their foot pressure is, because all of those things, it's like, you can do all of the exercises and you can do all of them inaccurately.
Yeah.
And that's the part where I don't want to create like fear mongering around exercise. But when you're dealing with somebody that comes in who doesn't know how to move, or they are in pain, then the body's literally going to create inhibition, which is what she's talking about when people are coming in and they're in pain. And that's what she helps treat, is that inhibition. But like, they're coming in, the body's not going to move them into positions that it's not comfortable putting them in. It's literally a safety measure. And so if they were doing the exercises on their own, they're going to do them in a way that allows them to work around the inhibition, which means all of the things. Right. Yeah. Right. And so all of those things that I'm trying to work on and target, it's like they're completely avoiding, and they don't mean to when they're doing the exercise, but that's what I'm having to hammer home. So I'm like, nope, we need inside foot pressure. I need slip into the knee. I need you to load into the glute. Like, these are all cues that I give to my clients because they're so foreign to them. They're not used to them. Those are places that the body is not comfortable going, or just completely unfamiliar with. Yep. And so it's strange, because it's like, I feel like I'm teaching grownups how to walk again.
Yeah.
Literally. Like, you thought you learned this when you were 1.
Yeah.
But you didn't. Yeah. But you didn't. We're trying again.
1000%. And yeah, that's so much of it. And so it's great with us having the communication that we do over those patients too, because if they come in one day and I'm like, okay, they're restricted at their, like L5S1 joint area, and that causes this kind of nervy pain down the leg, and I could see where that causes weakness in XYZ or trouble with XYZ movements. And then you're like, hey, like, that's getting better, all that. Or the patient comes back in, they're like, oh, training with Abigail this week was like awesome. I was able to do, that split squat with the right leg in front without like wobbling over or something like that. And then I'll start working on them. I'll be like, okay, yep, that's moving a little bit better. And then as I'm treating them, I'll be like, like you're not having a great anterior glide with your hip. And I'm like, I'm then texting you like, hey, how's like hip extension going? And you're like, yeah, they're getting a little bit of pain or a little impingement here. Then I can work on unlocking kind of the mechanisms of that extension, while you then retrain it properly to have proper muscle recruitment, and not just that one muscle or tendon doing all the work, but creating like that whole motor recruitment firing pattern, getting all of the muscles of the hip working together.
Yeah. I think it's hard to sometimes for both of us when it comes to running clients. They refuse to stop running, which is
all of our patients that are runners that are the ones doing this. Yes, we are talking about you.
Yeah, I'm calling you out. You guys all refuse to stop running, which is understandable. Like, I don't think, as somebody who, I love exercising, I love running, I love lifting. it would be very hard for somebody to be like, no, you can't for the next 2 to 4 weeks. Like, I just need you to chill, or we need to severely modify volume.
Yeah.
I'd be like, yeah, fuck you. You know, so I get it. And simultaneously, it just makes the process longer. And that's where communication comes into play, and understanding that it's like, hey, we have a team behind you and we're communicating and we're talking about you more than you think.
Yep.
And also just know that this process is going to be longer if you choose to continue to run during the rehab,
For sure.
which is okay, because it's like, that's fine. But this is what we recommend. We recommend this much less. We recommend this much more sleep. We recommend you focusing on this area in nutrition. And we also recommend you do this in terms of treatment with Haley, this in terms of sessions with me. You don't have to do it. This is like the protocol we would give you.
Yep.
And if you want to continue to run the way you want to run, the protocol might shift. If you want to continue to sleep like crap, this is how, like, the protocol might shift. The duration of the protocol might shift. If you want to continue to not eat or underfuel or eat terribly, then it's all going to change. Like, these things are going to change. So it's sometimes I have to get real with my clients and just be like, how dedicated you are to running. Like, how dedicated are you really to running? Because if you're really dedicated to running right now, you'll stop.
Yeah.
You know, like, if
It's
you're
a tough pill to swallow sometimes.
Yeah.
When you're the athlete, you know, on the other end of it.
Oh, 100%. I say that. And also, I've been the person that's like, I don't know.
We all have. I think that's why we got into this. Yeah.
Yeah. I need to get needled after this.
Yeah.
You know, like, so I get it. But also at the same time, it's, there's an awareness around healing takes time. And when people come to you and I, especially runners, they are stubborn and they have likely tried any other option, any and all other options.
Yeah. But then it's awesome whenever and we've had so many athletes that kind of halfway commit to our healing process of, all right, I am going to go see, you know, Dr. Haley or someone at the Real Recovery team. I am going to continue training with Abigail, but I'm still going to get my runs in. And then they hit that point of just like, either I'm never gonna be able to run again, or like, I'm just going to go all in, because they keep nagging me about this. And like, all right, fine, here it is. But then when they trust in the process and then we start making progress and you just start seeing that smile like come up on their face, and you just see like the wheels turn in their head of like all the new potentials unlocked, because we are actually getting them out of pain and they are actually moving better. And then they actually get back to running and they're having new PRs, or they're going further distances than they ever have, like without pain. It is like one of the coolest things. Like, one of my favorite parts of my job is like, after that athlete starts really taking it all seriously, putting in all that work, them getting to experience the payoff. And you're like,
yeah, absolutely. I mean, I talk about the negative in terms of like, they come in and it's really hard for them to commit to the process and they don't want to stop running and whatnot. But I also have a lot of athletes that I kind of embrace the whole, like, I'm not going to stop running thing. That's just what I assume now at this point when I work with athletes. And it's been really cool, because I've also seen a lot of my clients Steph Lyles, like, she's going to be on my podcast, and she's somebody like, has recruited all of Gulfwinds to me, you know, because they watched her go from a place of, I will never be the same runner, and I just might not ever even run well again. And I just don't understand how, like, this is just kind of the end of my career, to hitting PRs, running all the time, like, just qualified for Boston again this next year, running her Boston Marathon. And, you know, I have clients who are training for grandma's marathon right now, and she's just like, this is the most amount of mileage, the highest intensity block I've ever done, and I don't have any pain. This is crazy. You know, I have people, she also just won World's Masters in second overall, first in her age group. She freaking did the Palace in like 1708 or something. It was just stupid. It was so dumb. I'm like, happy with my 2033 time. I know, like, I'm fucking crying. But I mean, I have clients who are just like, they'll get done with such, Kelly, who was dealing with knee pain. Like, she still deals with frustrations, because tendinopathy is a biatch to deal with. Like, it's just,
especially
really,
for females, postmenopausal.
Yep. Really hard. But also, she's constantly like, I ran 22 miles this week.
Yeah.
Like, and I'm upset because I'm not running as fast as I want. And I'm still dealing with, at the end of my week, some like achy, but like, I ran 22 miles this week.
Yeah. Where she was able to run zero. And even just walking up and down stairs at work was sending her into like insane pain and exacerbations of symptoms and stuff.
Oh yeah, and just watching people and the way that they move in the strength room. I don't always get to see them run, but just the way that they move. Oh my God, one of my clients, Deanna, she's awesome. She was running and somebody stopped her run. Didn't know that she had started strength training with me, and they were like, "Your run form has gotten so much better."
That's
Deanna
awesome.
texted me and she's like, "We've done like 3 sessions together. What's happening? What's going on?"
She's like, did you hire this person to come track me down?
I actually sent somebody on your run path. I know where you run. And they said that, my phone's gone. And they were like, I said, tell her run form looks amazing.
1000%. So how about we do this? How about let's switch it up? So we've been talking about the people that know running and are running. Let's talk to those that are curious about running and have never been a runner.
Freaking strength training, for the love of God. Make sure you do that too, please.
Yes. So I think like I can speak to this a little bit because I'm beginning what I call my runner's era of, I did a bodybuilding show 2.5, almost 3 years ago now. Mm-hmm. I've always played sports, volleyball is my main one, but basically I've been in a weight room since graduating high school, which is 10 years ago, which is insane to think about. But now doing something new and going, I know I'm getting old.
I'm thinking about like when I graduated high school and I was like, fuck, that's a long time ago.
10 years coming up, just wait for it. It's a good time. But for me, I was just fed up with going into a gym, and I still love to strength train, but like I got to such a poor like mental space too, or my shoulder, my neck, like whatever, like my constant things, because I'm always doing the constant movements. Even though I have variety in my training, we all still kind of have like our go-tos and things like that. So it just became more of like what I would equate to like a clocking in and clocking out job of like, okay, I showed up to the gym. I kind of like went through the motions. Some days I have good days. Some days I have not great days. But then it was like, I felt like my stress from work and, running a business and being an entrepreneur and all those things, the sleep's not great a lot of the times. The cortisol levels are always high. And then kind of having the monotonous routine of going to the gym, I just got into such a rut, and I didn't realize what a rut I was in because I was still going through those things. And now like beginning running and like having zero expectations set forth for it other than like, I'm just going to do something new here and embrace like being a newbie at it. And I can't like mentally beat myself up because I don't have anything to compare it to. It has been like the freeing and like coolest thing ever. But I was super intimidated at first to start running because I was like, I don't even know the last time I ran a mile without stopping. And, here I did a fast last week, but the week before that, like I was running 5 miles without stopping once. I never in my life like thought I would get there. And like the way you've set up the programming for me, it's been really fun and really easy to just like look at, digest. And I have a clear path of things to do, but I don't have pressure around it. And I find myself like surprising myself, not falling short of like a goal or expectation. So kind of walk through like, I guess the process, and we can just use me as an example of like how you took me from not running at all to like, okay, here's where we're going to start. Here's where we're going to focus on and go from there.
I think part of it is going into it with it, which is, okay, well, what's the end goal? What do you want out of this? And for you, what it seemed like was just like, I want to enjoy something again. Mm-hmm. I want to challenge myself, and I want to, while I'm challenging myself, not completely get in my head about it or feel burnt out, because you're challenging yourself in so many other ways with your business and what you do for, it's just a lot. And so I wanted to structure your training in a way that was not going to ramp up too quickly. I think that's a big mistake that people make, is they just want to immediately start running, 4, 5, 6 days a week. Mm-hmm. So, that would be advice for everyone. But for you, I didn't want you to ramp up too quick. And I also wanted to be something that truly you enjoyed, because you are an extremely hard worker. So there was no doubt in my mind that you were not going to be able to do something that I wrote for you. Mm-hmm. It was more, I want her to want to do it. Like, I want her to enjoy the process of the doing. Yeah. And so having runs set up differently throughout the week, which is maybe you have one long run, harder run in terms of, or just a mentally hard run, something where it shocks you. That was the like, I want you to run for this long. And I don't care if you go 2 freaking miles, you're just not going to stop running. I don't care if it's a slow trot, whatever, but I want you to do this thing because I knew that you could do it. And I just wanted you to surprise yourself. And I didn't want any pressure on it. It was just like, this is the time that you're going to run for.
Yeah.
And just whatever you clock, you clock. Having a different types of runs set up. So like not making every run that, because then it's just a mental like mind game that you're playing with yourself every time. Having a little bit of, okay, we're gonna do a little bit of speed work. So I'm gonna have you run for this amount of time and walk for this amount of time. I'm gonna have you do a little bit of threshold work. So I'm gonna have you run for this duration and then jog or walk for this duration. But the way that they're set up, it's like we're still training speed, we're still training threshold, we're still training long endurance bouts, but you're doing it in a way that's not so like you're going to go to the track and you're going to run 400-meter repeats and you're going to rest this many seconds in between. It's set up in a way that's like, I just want you to run a minute and I want you to walk a minute.
Yep.
I want you to jog for 4 minutes, or I want you to jog for 10 minutes. And then I want you to take a 90-second rest.
Yep.
It's like, that's threshold work. I mean, just by the way, but it's not said as, okay, well, I want you to run a threshold 2 mile at 10K pace. And then I want you to like, cause then you're like, what the fuck? I don't even know what it was my 10K. Yeah. I'm so confused. And that was my initial, I jumped in when I started running. It was a no pressure thing. And then I started running with some of my clients that I now work with. And they're like, all right, you're going to do a 2 mile threshold at a 10K pace. And I'm like out here stressing the fuck out because I'm like, I don't even know what my 10K, I don't know what my 10K pace is.
Yeah.
Like, I don't know, or I want you to run these 400-meter repeats. I want you to do it at a mile pace. And I'm like, I can't tell you the last time I ran a mile. I have and so it was interesting because I had to regulate myself and just be like, nope, I said I'm going to do this for fun. So I'm just going to go and run. Yeah. And I think that's my first piece of advice for everyone is just, you can get thrown into the freaking winds with all of the stuff that's out there and all the ways to train, and really just starting with something that you enjoy is the best thing. You also reached out, you hired a coach. I think that's smart. Yeah. Hire a coach, like hire somebody who knows how to program running, hire them. If you have no idea how to strength train for running, like get a program that a strength trainer has for runners, or hire a trainer that will help you. Like make sure that you are strength training while you're running. Make sure that you ramp up volume slowly and integrate slowly. Obviously, if you hire a coach, they will do that for you. And make sure too that you don't need to like sit there and start obsessing about like how many hours of sleep you're getting and making sure you're getting carbs right after and whatever. But like give a slight bit of a shit about when you sleep and how you sleep and how you eat. Like let's eat whole foods. Yeah. Around your training session, you might want to have a little bit of carbs before, have some carbs and protein after. Supplement with electrolytes. They're helpful. They will help you. You need them, especially if you're running in Florida right now. If you're sleeping, it's not like you need to sit there and be like 8 hours, but like give yourself a window of 8 hours to sleep. Like get yourself to bed at a time where you could go to sleep and wake up and it would be 8 hours. It might not be 8. It likely won't be 8, but like give yourself the chance, a fighting chance to get good sleep. You will be more productive during your day. You'll feel better. And I think also you're not an elite runner. So it's okay. And like whatever goal you have, it's like give yourself a reasonable timeline. Don't make it so reasonable that you can mess around and do nothing for a long period of time, but like give yourself a reasonable amount of time to accomplish whatever goal you have, because you're not getting paid to do this. Like we're not getting paid to, it's all good. You don't need to, because I think a lot of people try and add volume so quick and then they end up in pain. They end up with, oh, my foot hurts. I've got Achilles pain. My knee's hurting.
Or like trying to come back and like make their mile time that they had in like middle school, or something like that.
Oh, 100%. They're trying to put up like I have a couple of clients who are college runners, and it's just like always looking back to the glory days, and it's like, yeah, you weighed 100 pounds and you were 22, right? Like, no, it's okay. You'll be fine. And I've seen people who progress and they hit PRs when they're much older, but also it's like you have to embrace the fact that you are not that athlete anymore and start redefining how you are as an athlete now. And it might be better than you were in college.
Yeah.
But also, it's still not the same person. And continuing to look back on that thing and fight yourself to become that thing is going to keep you from making the progress that you want as an athlete now.
For sure. And just to kind of give you guys like an example, obviously, I highly recommend reaching out to Abigail, and like she would create a custom program for you. But I mean, like my program starting out was 2 lifts a week. Mm-hmm. It was upper and lower body. There's a lot of banded work, kind of like rehab-ish exercises, and can still go heavy with some things.
I gave you full body because I was like, in case you miss.
Yeah. So you give me 2 full body days.
Yep.
Which, you know, going from a 6-day split of like all these things, like I was like, oh, this I can do this.
Yeah.
And then you gave me like one longer run, and then one like I'll call it like a medium run, and then the other one was just like 10 minutes, like run 1, walk 1, or something like that. And so it's like, it doesn't have to be as involved as you think when you're starting out. Like it can be just something that simple, and it gives variety, but it gives you something where if all you had to do is dedicate 10 minutes of your whole day and you've checked off part of your program, like that's a pretty awesome feeling. Mm-hmm. Everyone's got 10 minutes in their day.
Mm-hmm. I think it's just not getting out ahead of yourself, which is people think that they have no time. Mm-hmm. Then they want to start doing this thing. Now they have all the time in the world. I want to do this 6 days a week, and I want to run, and I got an hour and a half to dedicate. And then they realize it's somewhere in the middle, which is you do have time. You don't have all the time in the world. You are still busy. You still work a 9 to 5. You still have 2 kids. Like you still have stuff to do. But also, I think it's you can dedicate enough time to it, and let's just start and see where you are and not set yourself up to be disappointed yet, which is like, let's give yourself something that I know that you can fit into your schedule, and I know that your body can handle, and then we'll start to undulate and change from there. Yeah. But like, we need to establish a baseline first. Yeah. And so if you're trying to jump in and essentially get to a place where it's like, this would be like at the end of a 12-week block, like this is your peak, and that's where you want to be on week 1. Mm-hmm. And you're just not going to feel good. Right. I made the mistake. I'm like, man, I've ran, I do cardio, I train jiu-jitsu, I'm tough, I've lifted, I'm good. And I kept my 4-day, like I was lifting 4 times a week, and I started trying to go regularly from running like 6 miles a week to run 20 to 25 miles a week. Mm-hmm. And my runs are not all easy. Like they're not. So, and I was by the end of my training block, I was like, my freaking knees. Yeah. I felt like a fraud. I'm like, what? I'm a terrible trainer to my own self. I'm sitting there. I'm like, my knees hurt. I got sick. Like, you know, I was just like, I was not good. Yeah. And so I had to be real with myself. I was like, all right, you are your own client. Mm-hmm. We can handle the running volume. We cannot lift this much the way that you are lifting. Yes. Because I like to lift like all I'm doing is lifting. Yeah. So it's like, okay, we need to lift 3 days a week. We need to make sure that the volume is totally regulated. These lifts are going to be shorter. They're going to be stuff that my body can handle, but it's really going to set me up better for running. Mm-hmm. And then we're going to keep my running mileage where it is. And then we're going to slowly add volume. And now I'm at 30 miles a week. And it's like, I'm okay. It's like, it's crazy how if you apply these principles that you're supposed to apply to your clients, to yourself, how much better you'll feel. Yeah.
You know, we're all human, right? Like I did that the other week. I let myself go too long without treatment, without getting soft tissue work of any kind. Oh, yeah. I started to feel my neck locking up, and I was like, oh, I'll be fine. Got home. I was like, I don't have time for a heating pad. You know, did my other work, laid down in bed. I literally felt like my neck shift over, and I was like, when I lift my head off this pillow,
you know it's going to hurt
so bad. So then I'm walking the office, and I'm like, you know, turn the whole body. And like, luckily I have a team of doctors who can work on me, and an awesome massage therapist. Shout out Mel. And it's just funny. It's like, you know, if I would have done what I know I'm supposed to do, which is like get my regular needling and adjustments, like if I would have done that treatment that I was too busy for 3 weeks ago and taken that 30 minutes, I wouldn't have been like where I am now.
And that's why full circle, I have a lot of empathy for running, for like my clients that come in to see me, runners or not, because a lot of people will come, like I have a lot of athletes that come in to see me and they'll come to me in a place of like pain or just like, oh my God, or I got to stay in shape for a season or whatever. I get why why they're like, I'm not willing to give up my sport. You know, I'm not like, it took me a while to come in to see you, you know, because it's like, we do this for a living and we still doubt our own practice.
Yeah.
We still doubt the efficacy of, or how valuable our own stuff is, because we'll be like, no, I don't, I'm good. We don't need, whatever. Yeah. And then you realize you're like, oh my God, my job is so important. You know, like this is, wow, I really matter.
We preach to people, don't wait until you're symptomatic to come in.
Oh, and then we wait
until we're just completely in the trenches. And it's
absolutely.
Like, all right.
Yeah. So it's, I get it both from a standpoint of like trusting that what we do is going to help, and also getting to a place of like preventative care, like do it before. do it before. You know, I would love like the day that clients start coming in to see me before they're hurt. I'm like, oh, I can't wait for that day. Like I can't wait for runners to be like, hey, I just heard that strength training is good for me, and so I wanted to start doing it. And I'm like, oh my God.
1000%. Yeah.
You've answered my prayers. You know, or somebody to be like, hey, I mean, because I'm referring you to people, but again, they won't do it until they're in pain. Yep. And it's like, I cannot wait until I have a client where I'm like, hey, go see Haley. You should go see her like once a month or even once every other month, but just get it now before. And oh my God, the day that you have somebody come in and be like, hey, Abigail referred me and nothing's really wrong. I just want you to do an eval and just see like if there's anything we need to treat. You'd be like, oh my God. It's the best day of my life. Yeah, right.
No,
right.
It's good. So I think top advice to somebody if they're looking into getting into running, one, hire a coach who's knowledgeable that can give you something to really work with without overwhelming yourself or creating an injury that you don't have or re-aggravating a previous one. I would recommend checking in with a physio of some kind. So you come to Real Recovery, you could go check in with another like local chiropractor or doctor of physical therapy, and they can just kind of do like a whole body, like joint assessment, movement screening, and just make sure like the foundational stuff's good. And then whatever strength coach you work with, they can then do their own assessments and perhaps do a gait analysis or just talk through things. And then from there, like between the two, they could give you the tools in your toolbox where all if you want to do is like everything from home and just follow a program. By doing those two things, you already have a team around you. So then if things start feeling off or weird or your body doesn't start feeling good, you now have a team of people to ask questions to. Should I be doing cold plunging? Should I be doing Normatec sleeves? Do I need to do this mobility work? Okay, I need to strengthen my glute med. How do I do that? And like, you know, what does that look like?
And ideally, you don't even have to get there because they've already looked at your programming and and know your history and know your body well enough to be able to keep you out of a place of having to ask a bunch of questions. Honestly,
absolutely,
which is the most important thing. But also, the big thing is just like this is something that you want to ideally do forever. So treat yourself like this is something that you want to do forever. And if that means hiring a coach, if that means hiring somebody like Haley, if that means going and getting a gait analysis test done, if that means, you know, making sure that you're like, I'm getting 8 hours of sleep every night, whatever it is for you. Part of it is like, this is quality of life stuff. Like this is, we are here to actually enjoy life. I think I'd like to hope, I think. And, I'm like, we might as well, you know, we're here. Sure. And so to be able to do that independent of, you know, I'm running and I want to accomplish this goal. It's just like, I want to feel good and be able to show up for life the way that I'm supposed to show up for life for. And that was a big thing, I think, for you after bodybuilding and the way that you were training and stuff. And for me, after some of the way I was training, it's just like, we know what it feels like to not feel good and to train in a way where we're like, we can't show up for life well.
Yep.
And so I get it. I also get how it feels to be in a place where you're in so much pain and you don't know what is going on and you don't know how to fix it, like how terrible of a feeling that is. And so being able to have people already that you can go and talk to, being able to have coaches, being able to have PTs, being able to have chiros, whatever it is that you can go and speak with, that are already there and they're like, oh no, we think we know what's happening. It's like the relief that you feel when you're like, oh, so this is probably what's happening and we have a solution. I mean, that in and of itself is a pain reliever.
Absolutely. All right. Well, as we start wrapping up here,
Yes.
I want to ask a fun question.
Oh, okay.
So Dr. Nicole had an idea of like asking people like what their favorite muscle is or stuff like that. But I think since you do what you do right now in today's day and age, what is your favorite exercise?
Me personally?
Yeah.
Okay.
Like
so,
if you were stranded on an island and could only do one exercise.
oh, that's
what
freaking
exercise?
hard. Because if I do what I'm best at, it's pull-ups.
Oh.
If I
okay.
do what I'm best at, it's pull-ups.
Okay,
But
I
if
didn't
I
say
do
best at.
if I
See,
do
is
what
the
I
competitive edge coming out. What's your favorite, most enjoyable right now? Because you're a glutton for punishment. I know you are.
it'd be between a front squat or a rear foot elevated split squat. So, or a Bulgarian split squat, I guess is what a lot of people would call it.
Ooh, okay.
Bulgarian split squats. I'd say Bulgarian split squats because then I'm hammering my adductors. It's a little bit more functional. I'm getting work on my quads and also booty.
Gotta get
I'm getting all of
gains.
it, and also I can load it differently. So I can load it to really help with my with core as well. So I think probably rear foot elevated split squat if I'm looking for like all around pretty solid.
Final answer.
Final answer.
Awesome. Well, thanks so much for coming on today. I
Thanks,
appreciate
Haley.
it. We'll keep it going because all the people want to know all of the Abigail knowledge.
Yes, we'll make it a regular segment. The trainer you didn't want to hear from, Abigail.
All right, you guys. We'll have a great rest of your day, night, week, whatever it is, and we'll catch you next time.
Peace out.